thought it was so important that we kind of do a continuation of what we were discussing yesterday, right? Because we talked about public trust, right? It's not just about public trust. I wanted us to have a conversation today about medical information based off current events, right? We use it as a case study. So most of us assume that our medical information is private, right? We assume that it's private. We assume that when we go to the doctor or our therapist, hospitals, specialists, clinics, places like that, our information stays between us and the people that we directly were involved with, or people who are directly involved with our care, right? But my question becomes based off of recent news, right? Does does it? Today I wanted to talk about medical privacy, health information, public trust, and who actually has access to our information. That's what I wanted to discuss. Who actually has access to our information? And I don't want this to feel like I'm fear mongering. It's not about fear at all. It's more so about conversations of accountability and consent. It's about mostly the consent elements, right? Because we were talking about what safeguards exist for public officials yesterday, right? So I'm curious what safeguards exist with regards to our medical record or just what our personal health information, because what's supposed to be protected health information. And I'm curious what kind of elements are there. I'm trying to more so understand the system and how it works, right? Because I recently started to think about what happens when information we consider personal becomes accessible to larger systems. And that's the part I'm talking about, more so the protected personal information. How does it become accessible to larger systems, right? Researchers for certain things that they're working on, right? Insurancers, the insurance companies and things, because people feel they have to look at your stuff too. Health organizations and government agencies. Once again, the health, like the government agencies. We've been hearing a lot of discussion about what autism registries. How are you creating said thing? I recently saw some news where they said they were going to take everyone's health information so that they could assess it to understand autism. And I was like, that's a very peculiar thing to do, right? That's very peculiar. And it just made me ask the question about safeguards and protected health information, because how are you just able to just pull people's health information and assess for autism or whatever other outcome you're trying to access if this is protected health information? Did you get people's consent, and how did you go about collecting their consent? These are questions that I have, and questions I'm going to pose here, and we're going to dig into it, right? Y'all know how we do here on Legally Everywhere. We have a question, we pose it, and we start researching and looking into it. We might not come up with answers today, but we certainly going to lay some foundation, because when I saw that, I immediately said, I want an answer to that, right? So I wrote some notes, and I told y'all, just so I can keep myself on track, I'm going to look at them. Because all of that made me realize that people probably just in general, we don't know who actually has access to our information and the circumstances, or better yet, what circumstances they're allowed to access it, and like what safeguards exist. That's why I really wanted to have this conversation, because I just feel like across the board, there's not like a lot of discussion about that. So I'm gonna try to chop this into a couple things. I'm gonna give you one quick case study about something that happened to me myself, right? So I last year come to find out a health system that I have been associated with my entire life, right? And I'm gonna tell you, when I say my entire life, I mean my birth records are there. In my professional career, I actually interned, worked at this place, right? This is a place I frequented often, right? And I had come to discover that this health system was actually associated with some type of data breach, right? So if you were using their electronic medical record on your phone within a certain time frame, it was determined that you might qualify for, let's say, some funds, right? So, of course, I went to go research it further, because that was a little disturbing to me. As they would say, my flabber was gasted, right? I was flabbergasted by that. And so I went to investigate it further. And lo and behold, what I met criteria for them to do a payout. I discovered that completely by chance. I discovered that completely by chance. Hello, Michael. Did I read that correct? Yes. Hello, Michael. Um, I discovered this completely by chance, right? I literally had someone send me an app that locates claims or whatever. It was something they sent me about an Apple product. They said, "Hey, you have a lot of Apple devices. You probably qualify for this." I was like, "Oh, what is it?" They said they send people stuff in the email. I said, "Oh, I don't think I got anything in my email." They said, "Just look on this app." I looked on this app. Sure enough, I went to reconcile it with my emails, found it hidden in some folder somewhere. While perusing this site, I come to find out that my health system is on there. They tell you when you read it, "Oh, your health system should have notified you about this breach." Well, guess what? Look at here. No one actually notified me about this said breach. And I'm someone who has, I'm always looking at my emails, so I have multiple. And I actually could not actually locate even afterwards. And they told me where it should be located, about where this notice and disclosure happened. I didn't see it on the app. I didn't see it in my email. So there was no way for me to know, as an active consumer of that product, that I had my data potentially had been compromised because something happened in that system. So that's the kind of thing that caught my attention. When I'm looking at recent news and they're saying things like, "Hey, we're going to create a registry based off people's personal information, protected health information, better yet, specifically a protected health information or personal information," because how are you creating, let's say, an autism registry, right? We've seen that online. How are you creating this if, like, who could sense it to that information being able to be accessed and utilized to create this registry? How are you creating the registry? What data points are you using about this person's history? Because usually they de-identify information when they send it. So my question is, like, how are they going about that process? And that's kind of what brought me to wanting to do this live today, if you were at all curious. um because, like I said, I myself was very shocked that a system I had trusted nearly my entire life, my family had trusted, because all of their children were born through this health system. A lot of my relatives utilize this system. Um, to find out randomly that your information could be compromised or exposed or access was given, and they didn't even properly go about notifying us. I was shocked. I worked for this system and I had a lot of trust built into the system from being a consumer for many years, and then also having been someone who actually worked in that system for a short period of time. I had built a certain level of trust with working with them. So I was somewhat taken back, and it made me want to have these kind of conversations, because I feel like these kind of informed conversations should be happening more, but we often don't have them. So, my question for that section, because I have three or four sections: what happens when trust is disrupted, right? Because trust was disrupted. They were supposed to do what we call what continuity of care, service recovery types of things. Like, if you, they're not, let's move away from continuity of care. Let's do service recovery. You did something. It's your responsibility to come back and correct that, right? It's your responsibility to come back and to correct that. And they did not. They kind of put it out there like, "Oh yeah, you followed the rules of what was written. Oh, you have to put a notice out." But did you really actually go about notifying the community or the people, the consumers who were actually utilizing your services, that there was in fact a data breach, or there was some type of means or ways that your electronic medical record was exposed or compromised for X amount of time? Did you actually go about making sure people were informed so they could figure out how they want to cope or deal or handle that type of situation, right? So I see something coming in from Gary. Where am I from? I'm from Michigan. You said talk slower. You're from India. Well, hi, Gary from India. I will talk a little bit slower. Hopefully that'll help. You are processing everything I'm saying. I know you might be doing translations, and I don't want to interrupt that. So thank you for popping in. So essentially, I'm talking about the disruption in trust, right? How much risk do we accept when information is digital and been digitized, right? Because there are some benefits to having digital records. I won't deny that. I've worked in medical systems for quite some time, and I can attest to the accessibility of information. It's much easier to go do a very thorough chart review when you have it digitally. It's a lot harder when you got to, like, oh, let me go down to the basement and let me go look for some records, and hopefully it's being categorized the correct places and I can access it, and different kinds of things, right? There's certainly benefits to it being digitized, right? Hot accessibility. But then the question becomes accessibility. Who has access to your records? I see some more things in the chat. Hello, everyone. Right. So, who has access to it? And like, what are those risk elements? Because I'm always interested in risk mitigation, right? How much risk as the individual, as a consumer, are you taking on when they choose to digitize your records? And then they start to have these interesting processes as to how they're handling those records. Like, what protections actually exist for you, because we have these assumptions and beliefs in protections because we sign all these documents. Oh, okay, I agree, I accept, I understand that there are these rules and laws that are supposed to protect me, or these are policies that are supposed to protect me. But then what are the real protections, right? Because in my quick little case study, right, that quick example I gave you, as a consumer of this product, right, I utilize the health system. They never reached out to me. I actually was having regular appointments during that time frame. There was nothing I saw posted that said, "Hey, if you're using the EMR system, or better yet, your electric medical record system, that on your phone that you might have been compromised or something happened, just check it. See if you got an email." There was no dialogue like that whatsoever. They didn't tell me what I could do to protect myself better, right? Because really it was on their end. It was their issue, not on my end. So there's not much I could have done to mitigate it. So what protections exist outside of saying, oh, for every person who reached out to us, we'll send you like $10, and you compromise my personal health information that was private, I was told was protected. The best I might get is what, $10, $15? Mind you, the initial introduction to all of this was because I was looking for something associated with Apple products. Someone literally at by chance said, "Hey, I know you have a lot of Apple products. There was something that was going on. You should look into that and see if you can get money from that." I said, "What? What happened with the Apple products?" I went to look it up, and sure enough, I discovered that more than just Apple was something I need to be looking into, that a health system I trusted was something maybe I need to be looking into a little bit further. So that's just kind of like the question, right? Because you think about, when you think of your health system and who's involved, you're thinking about the physicians, you're thinking about the nurses, you think about the therapists, but you also think about the billing staff, right? The insurance reviewers, because someone had to review your claim for it to get paid out. The administrative personnel, researchers. Now, granted, when you think about the administrative personnel, they're usually doing that at a limited scope. Um, by Gary, um, they're doing that at a limited scope, but it's still about the conversation of access, right? Researchers, they get your information. They could have been on the collection side, or they could be on the side where they're just looking at the data points, right? Compliance teams, to make sure people are doing what they're supposed to be doing, they're looking at stuff, right? When you went to see your doctor, you weren't thinking about a compliance team looking at your records, nor were you thinking about a researcher. You may not sit in opposition of a research team, because a lot of times those research teams looking at things is what's helping improve health outcomes across, the whole spectrum, right? They're helping. But were you implicitly consenting to them looking at your personal records? Possibly not, right? You have to think about the students and trainees in some systems, right? I think back to working in what they call learning institutions. And one thing I found very interesting was the process that they use to get people to be okay with an intern walking into the room or a resident walking into the room. They almost had this assumed, like, this is a learning institution. So, yeah, they're going to kind of just come in here. They kind of more so would look to see if you, as a client or a consumer and patient, was saying no. That's how I interpreted that. A lot of times what they would say is, "Oh, it's a learning institution, they're they're completed most of their things, academic things for school. They need to be in here. Everyone always lets them in. It's no problem. They're here to just kind of look and observe. They're not going to be doing anything. They're just here, or they'll tell you they're going to do X, Y, and Z. They give you these terms to make it more comfortable for them just to walk into the room with you. But then you have to think, if they're in the room with you, they're probably also looking at your chart. Not to say there's anything harm with that. Of course, you want people to be properly trained. They do need exposure before they get out into the field. No harm, no foul there, right? It's a lot of times it's the presentation of how that person comes into the room. They often are asserted to come in the room. I have experienced that on both ends, being the person that was being walked into the room to observe or to work with. I experienced it as a patient and a consumer. They just brought someone in. Hey, this is an interesting case. Want them to see it, right? So you have to think that there are also these additional people that come into these rooms, right? The trainee, the student, the intern, the resident. Resident, obviously, a higher degree, right? They are literally about to become a doctor. But you have to think, in learning institutions, you also have interns, clinical interns, or interns of some sort, right? Student learners that are coming in, trainees that are also coming in that potentially are looking at your charts that you may not have been thinking, hey, maybe having access to my protected health information. So, who needs the access became the question there, right? Who should have the access becomes the question. What limitations should exist, right? Because in theory, if you're like, oh, you just come in and see me, you probably don't. If you just want just to observe for your learning experience, did you really need to do a full deep dive into my chart review? Maybe, maybe not. The administrative person who's typing your stuff in should have a limited scope of what they're accessing in your chart, right? They shouldn't be doing the same kind of review as someone who's clinically engaging with you, correct? Most of that should be addressed within that system, right? So once again, it's not about fear. It's just the questions about how it's structured and how it's all is handled. So I kind of talked about the learning institution. I told you I got some notes over here. Let me see if I wanted to add anything. So with regards to that piece, while we're still on this topic, how is consent obtained, right? I found that portion when I was training. It's over a decade ago, right? You're like, you look kind of young. Over a decade ago. So my hope is that that process has been cultivated a little bit better, right? That they have patched that up a little bit. But in general, because I had sat on patient side, once again, I use those health systems or that health system. So I've seen, even when they bring someone in, just a regular specialist, right? I'm like, okay, this is a learning institution. Have them come on in. Oh, they already have them in the room before they ask you if you're consenting. So it sometimes can give the impression like, well, I don't want to make the person uncomfortable. I don't want them in the room, right? It puts a lot of pressure on the client, the consumer, the patient to be like, no, no, as opposed to just giving them the opportunity to consent beforehand. That pressure was, in most cases that I observed, was a little bit more intentional. I can't say to all situations because I don't try to speak in absolutes. But in the situations that I have observed, it's usually a little bit more intentional so that they can get the outcome that they want. Sometimes it's better to add to express an apology than to ask for consent in a lot of situations, right? I can't remember the exact quote, but I used to hear it a lot when I was younger, right? It's better to ask to express apologies and I guess to ask for permission. I can't remember the exact quote at this moment, but like I remember that was certainly a thing. So that was a question. Um how informed is the consent? Like, I'm always interested about the level of disclosure when they get your consent, right? Because sometimes they'll tell you about A and don't mention it's all the way to G. A through G is what they're trying to do. Similar to the example I gave yesterday, with the first live that I did yesterday, and we talked about that military training that occurred. And I said, well, what kind of disclosure did they give the community before they did this military training in this residential area? Like, how involved was the disclosure? So, when I say, like, how informed was the consent? when they said they were going to access your information, did they tell you all of these potential parties could have access to your information, or did they just mention one or two of those parties? Um, it raises questions about like what patients should know walking in. How much choice does a patient actually have? So these are just kind of informed questions I like to have, because what we talk about governments, we talk about being informed walking into situations. How do individuals absorb the impact? How do we absorb the harm, right? Of the decisions that are made in rooms that we often weren't invited into. We're the benefactor of a lot of the things that occur, but how do we absorb that harm? And what do we do with it once it has occurred? So like these are just important conversations I feel like we need to have um about it, because we're really talking about like these privacy elements, right? Because education and privacy often do kind of intersect, but who's absorbing that impact when that's occurring, right? We're moving down to one of my last two sections, and I'm just going to, go from there. Like, once again, I said, which is just more so questions that were on my mind as I was thinking about what does it mean to have like an autism registry, and it's the news saying, hey, we're going to use people's health information to learn about autism. I just found that very peculiar, and it just made me ask more informed questions, and I wanted to share and get your feedback. Like, so I love doing this on the mobile devices. I'm actually getting to engage with you all. Public health research can improve outcomes, right? And we're all very much in support of being able to improve health outcomes. We've seen what's happened in the last few years with health outcomes. We're always looking to improve that, right? Research helps us understand that. I was a research intern at one point in my life, so I certainly sit in support of research. Um, but I do have some questions, right? Because research helps us understand disease and disability and treatment outcomes. It helps us with population trends, prevention strategies, which is another area I find very interesting, right? But at the same time, people want privacy. And a lot of times they're looking at data, that certain kinds of data. You have different ways you can extract information from research. Let's not deny that. But it just makes me interested in the balance between the two, of the privacy that people want and the level of access sometimes that these places feel that they need. The question is, how much do they actually need? Um, and how protected is your privacy, your protected health information? Protected, right? Like, how protected is it? How private is it? So, how much information should be available for researchers or for research in general? Like, what should consent, like, when should consent be required? Because I feel like some data points that they get, especially when we talk about teaching institutions, places like that, to have access to your health information, and they're also working with researchers. Like, when when is consent like required if the information's already been collected, right? Because when they're talking about some of these registries and these different things that they're going to be collecting data from, it makes me curious. Well, where are you getting the consent? Because when they said they were going to do an autism registry, that one's been kind of, I just been thinking, like, how are they collecting this data? Who's consenting to this data collection? Like, how are they going about that? And it's just so intriguing to me that I said we have to get on here and I have to talk to my people and we can just chit chat, because I'm interested, right? That's an interesting question, right? If they say they're going to just, that was earlier in the year. Now they're saying things along the lines of, we're going to look at everyone's information to understand the autism outcomes, which doesn't sound correct, right? You're going to look at everybody's stuff to understand one specific condition. That's peculiar, right? If nothing else, it just warrants further investigation, further discussion, because that makes me then question what protections exist. Next, maybe what protections should exist. Like, how should information be safeguarded? Because I've given you a couple case study little, examples to peruse and bite and chew through, right? Um, a lot of this bottles down just to like trust, the trust that we have in the system, or maybe the reimagined, trust that we have. Like, the way we're looking at it now in comparison to how we once did, right? We just used to just trust the system because it was built in. Public trust. Like you just trust. So now that we're put in situations where we have to kind of question, what does that mean? Not to make someone scared, but to be informed. So when you go in to talk to your health professionals, or you go in to talk to any place that might be having your protected health information, maybe you'll just look at those forms a little bit closer. Maybe ask the staff, like, who actually has access to my information? Why do they have access? Why do they need access to my information? Um, because within those health systems, you share quite a bit of information, right? You share quite a bit of information with the health system as a whole. Um, and I'm just interested about what obligations exist to protect that trust. Like, what exists to protect it, right? We all understand that it's easier to maintain trust than to have trust, lose trust, and try to gain it back. Right. And my hope here in the conversation is more so about restoration. How can we trust systems a little bit more? What can they do? Um, at this point, probably retroactively, but like even from a business perspective, proactively, what kind of things can they do to fortify the relationship that we already have with them? Because we've already had a lot of built-in trust. When conversations like the things that we see online occur, he faces some of that. So, what can be done to make us trust them a little bit more? Because it's not that we don't want to trust. We've already been trusting you. There's already a relationship there. There's already a rapport there. There's already substance that's there. We need to build on that foundation, because when I'm dealing with a system, I should feel like I can trust you with the information I haven't trusted you with, because I trusted those doctors, right? Just like yesterday's conversation with the individuals themselves, right? Now we're taking a little bit further out and say the system. We should be able to have trust in public things, like public trust in your professionals who are providing your care, right? Or elected officials that we entrust to do certain kinds of positions, two different kind of topics, similar kind of vibe, right? We should be able to trust you. We should be able to trust said systems. If the system is telling us to trust an electric medical record system, we should be able to trust said system, because I you vouched for that thing, right? The doctor vouch for that health system. If you were someone that was searching based off the doctor that you prefer, or that health system vouched for that doctor, saying, hey, this is the doctor we're going to have render your care, vice versa, depending on the person. Some people go based off referrals and a specific kind of clinician that they maybe want to encounter, or staffer, right? And some people do it based off the system that they trusted. But either way, you had a public related trust in that system or that professional. And such required me to utilize, let's say, an EMR system or some type of data collection tool system that you utilize. You told me I had to trust that to work with you, right? This is the place that's going to hold this information. So, how do we make sure people feel more validated in that experience? Like, what obligations exist to protect that trust? How do we balance research, innovation, public health, privacy, consent, transparency? And now we also know there's going to be a higher level of integration of AI. So how do we trust those tools? So I'm just going to ask these last couple questions, and I'm gonna phase into the next portion, see if there's any more questions. Um, my question to the chat this morning is: what do you think has access? Like, what do you think, or who do you think has access to your medical information, right? Should patients receive more notice about who has access to your information? Because you would think you would know, but we kind of don't know, do we? Unless you directly have interacted with the person, we don't know really who's in our charts. Unless you ask for your records, you go to them and say, hey, I would like a full record. How would you know who's accessed your records? How would you know? You would know that because of the way that the medical system is set up, right? Those EMRs, they give you a time step anytime someone's actively putting something. Now, if somebody's just perusing, unless you get like a forensic review of it, you might not necessarily see who all just saw, but you always can see the time stamps of who put something in the chart. But if you don't get that review of the chart, what you see on the patient portal and the clinician portal is two separate types of portals, right? Do you feel like as a consumer, you should get more notice about who's actually accessing your records? Now, it's a whole nother thing to talk about how potentially annoying that could be if they're like ping, 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 ping every time somebody touched your chart, right? Application might be a whole different conversation, right? But it is an interesting question, nevertheless. Should you be getting more notifications about who's actually looking at your stuff? How much medical information should be available for research, right? Because you're talking about the de-identifying information, right? There is a process that's definitely in place when you're doing research and you're extracting certain information from the data itself, like the raw data that's supposed to be used, right? A lot of times when we see the research, we're looking at the raw data. They have de-identified that information. But we also can't deny that there's someone who has that information in its more raw functions and portions. And there are certain people who would have that data, right? Um, another question I had was, should consent be required every time information is used? Once again, I talked about how application of that particular thought process might be a little bit more like, oh, that's too much. But should we have, if someone wants that, should that be an option? I don't know that that's currently an option on the menu, right? But it seems like it might should be a consideration at this point. Should protections, better yet, like what protections would make you feel more comfortable? Because at this point, we're trying to restore faith because the public trust is dwindling down, which is not good. So, what protections should be put in place so that people feel more comfortable with these situations? Because to say people aren't going to access their medical records through their phone or computer, come on now. Like, not in current day and age. You likely will still continue to use these resources. So, what would make you feel more comfortable to use them at this point? What can they do to fortify the relationship because the trust has been effaced, it's been marred. They're not, and a lot of times I feel like putting forth the effort they should to restore and repatch. So the question is, what are they going to do? At this point, it's retroactive, right? It's not proactive like it should have been. It's going to be retroactive, but what are they going to do? So in close, I did try to, let me look at my notes real quick. This question isn't like anti-research, because I would never say that, because I was a researcher in my youth, right? I was a research assistant. Um, so I'm not saying that. I very much believe that we do need the research. I want the research. I'm somebody who chews through the research on a regular basis. I want that research. Trust me. I'm not anti-research. And I'm not anti-healthcare. I've worked in those industries for quite some time. Spent a decade of my life there. I'm not anti-healthcare. I'm very much in support of people getting their health needs met and having as many diversified, qualified personnel to help, because different people see things different way. Um, there's a certain art level I feel like that comes with the science. They're the way that they go about it. That's why you feel like when you work with different clinicians that they're able to meet your needs differently, because there's a certain, you have the knowledge, right? This knowledge set yourself, but there's a way that you express yourself. There's a way that you approach things, right? You're going to have the clinical approach or scientific methods that they say that you go about, but with in that there's going to be some space and opportunity for you to display it a certain kind of way. And I feel like there's a certain creativity that comes with that, right? You'll always be like, there's this one doctor that really worked, right? There's this one clinician that really worked. And that thing that really worked was that creative expression that they had within that set modality, that set scientific method, that set whatever, right, that they had to utilize. So I'm not going to deny the fact that we want to have as many diverse, qualified professionals that can make sure that we can help people get to the best possible health outcomes. Whatever helps bring them to a homeostasis within their bodies and their systems, that's what we want to happen. So never would say anti-healthcare. I'm in support of healthcare. I'm in support of research, but I'm also in support of protected things being protected. I'm also in support of patients and consumers being informed about things and not finding it out after the fact and not having much recourse to correct things. I'm in support of service recovery, where you are correcting those kinds of things in a reasonable, measurable kind of way. So this conversation is mostly about trust, right? Because relationships at the very core of everything I'm saying. For some people, they're like, you're kind of talking at, about different things. At the very core of this, although I tried to scaffold it a certain kind of way, we're talking about trust. Every relationship you have is usually has a very deep root in trust. You need to be able to trust what is being said on the opposite side of the conversation, what is being done on the opposite side of the conversation, especially if you're not in that room. If you trust them to do something, you have to trust that they did what they said they were going to do, the way they said they were going to do it, when they said they were going to do it. And if that doesn't happen, what are the ramifications? How will you settle accounts? How will you make me whole? How will you correct this? How will you make this better? A band-aid doesn't make it better. It just covers it up and potentially shields you from further injury. But what about the harm that was already done? You wouldn't just put a band-aid. You need to do more than that. And I'm asking, what is the more than that? If a patient um or patients are expected to share personal information, what safeguards should exist to ensure that the individual's information is protected, used appropriately, and handled responsibly? Handled with care, right? Handled with care. Um, how much access I'm gonna end it like this. How much access is too much access? How much access is too much access? The world we're living in is changing. The way that we have been consuming things is changing. The way that they have been processing things is changing. The types of tools that they're integrating has changed. How much access is too much access? Can you control the impact? What risk mitigation is being put in place so that the consumer isn't absorbing that harm and taking that hit? Nobody's trying to be a crash dummy because we wanted expansion. Crash dummy, if you think about like cars, right? Automotive. Like you don't want to be a crash dummy just for the sake of saying we wanted to learn more and do more. Will things happen in the process of trying to grow and expand? Yeah. But there should be some levels of risk mitigation. There should be some protective factors. There should be some level of care and consideration that's put in place to make sure that people will be okay. So when we talk about who has access to your information, who has access to your information? And the larger question is, how much access is just too much access? So we have looked at a couple of case studies. I told you I try not to overly dive into one isolated incident because a lot of times these are bigger conversations. I look forward to seeing what you all put in the chat as it goes into replay mode, then it just sits on my channel. I do appreciate you all who did hop on just live with me this morning. It is always a nice little treat for me to be able to talk to you all. I look forward to seeing you in the next video, next time, in the next discussion. This is Legally Everywhere with y'all. Well, we legally everywhere. We looking into everything. See you in the next video.